So 13,000 women in the U.S. are diagnosed with cervical cancer each year, but what you may not realize is it's a preventable disease. Oncologist Dr. Michelle Rowland of St. Luke's Cancer Institute is here to tell us how we can take the right steps. So welcome, Dr. Michelle. We really appreciate it.
Good morning.
So let's talk about who is at risk for cervical cancer.
So all women are at risk for cervical cancer. Because of this, we recommend taking steps for prevention to prevent this in women. And currently there is good ways that we can prevent cervix cancer, including both HPV vaccine and pap smears.
Okay, and when you talk about pap smears and the HPV vaccine, how much are we going to be lowering our risk if we take action now?
Yeah, so it's estimated that the cervix cancer vaccine can reduce the risk by up to 90%. And we're very excited.
90%?
Yeah. We're very
remarkable.
excited because now it's been extended and women and men up to the age of 45 can receive their HPV vaccine. And by getting that, you can reduce your risk of not only cervix cancer, but other HPV-related cancers as well.
Okay, and you mentioned men in there. So why would it be important for males to go ahead and get this as well?
Yeah, so the more people that are vaccinated, the more we reduce the risk overall of people getting HPV. And there are other cancers that are associated, so we do encourage it for both men and women to get the vaccine.
All right, and when we do see people who unfortunately get cervical cancer, you know, it seems that most of those cases are happening with women who are not up to date in their screening. So how often should we be doing that, and how do they go about scheduling it?
Yeah, so we recommend women start seeing their doctor around the age of 21 for pap smears. Depending on the type of pap smear and the result of that pap smear, they may find that the follow-up is different. It's generally about 3 to 5 years, but what I recommend is as soon as you get your pap smear result back, that you ask your doctor, when exactly am I supposed to come back to get my next one?
Okay, well that makes a lot of sense. Now, if a screening does get missed, because sometimes they do, what are some warning signs that you can look for?
Yeah, oftentimes there aren't any symptoms at all, but if you notice anything that's new or unusual, we always recommend that you see your doctor right away and get it evaluated for that.
Okay, and why is early detection so key, both with HPV and with cervical cancer?
Yeah, so early detection is really the key to successful treatment. So we often can find women who have not yet, don't even have a cancer, they have a pre-cancer and we can treat that. If you do have early cervix cancer, the success in treatment is quite good. We find that for early cervix cancer, about 93% of women are disease-free at 5 years, according to the American Cancer Society, as opposed to women who are diagnosed much later, where their chance of survival is less than 40%. So we really want to catch them early where we can still have a successful cure.
Okay, and can you also give us some good news, right? Because maybe if the HPV vaccine came out and you were too old for that, that has actually changed, because this was the case for me like last year when I went to ask about it.
Yeah, it's actually been extended. It used to be only up to 26 years old. It's now approved up to 45-year-old for both men and women. So you can now get your vaccine, and we encourage you to do that.
Okay, well, thank you so much. And of course, that is good news for all of us. Dr. Michelle, thank you for sharing all of your information.
Thank you for having me.
So to make an appointment or for more information on vaccines and the steps that you can take to prevent cervical cancer, visit stlukeskc.org.